Welcome to Primesuite. The following demonstration is to show you highlights available when Primesuite is implemented. Pyramid Medical is a full-service billing center that offers to install and support Primesuite as well as manage your billing needs. A more complete demonstration, including your specialty, is available upon request. Let's get started. The clinical desktop contains a black action panel that will keep you up to date on outstanding items needing your attention. Unsigned documents will allow you to quickly access and sign, return lab results, notes, and scan documents. Task List allows you to send a request to staff or respond to requests. Within Tasks, you can quickly access the chart or face sheet to order a test or prescribe medication. The patient chart list contains any patient's chart that you have currently open. Clicking will take you to the chart. Your patient list will contain all patients scheduled for today. A status and area will allow you to see where your patients are in the office and when they are ready to be seen. Customization of your patient list filter allows you to select the fields most important to you. Different filter presentations allow you to understand that yellow patients are checked in and those with a gray line are checked out. A faded background indicates that a patient has been canceled, rescheduled, or no-showed. Prior to creating a note, you will have access to the library of templates that have been reviewed for content and accuracy by Greenway specialists. These templates can be modified by you, or new templates can also be created for your special needs. Back at the desktop, by left-clicking on your patient, you will navigate to the chart where you will be able to review the patient face sheet, history, medications, and create a note. On the face sheet, we're going to click on one of the history bubbles. This opens up the History and Habits wizard. From the wizard, I have the ability to enter on the past medical history, past surgical, meds, allergies, family history, genetic, reproductive, social history, and problems. To make a selection, I will use one of the categories listed on the left-hand panel to enter the problems that my patient has. I also have the ability to customize and create a category that is unique to our practice. After I select the problem for the patient, a detail tab will open up and you'll be able to add additional information. I'll navigate through each of the histories, completing this information. Some of this information is required for meaningful use, such as tobacco. In the tobacco details, it's also required to indicate the use status. Any additional information that your practice requires should also be entered. In the allergies, I have the ability to enter an allergy or to mark it as no known drug allergies. On the left-hand panel, I can enter food and environmental allergies as well. For medications, I have the ability to enter recorded medications that are prescribed by our practice, recorded medications prescribed by an outside practice, and the ability to retrieve prescription history. Another way to enter information on the face sheet would be to use the local search. By clicking on this magnifying glass, it opens up a search window, allowing me to put in another problem. Once I click on the code that works for me, it will populate it onto the past medical history. I then can click on the hypertension and enter the detail, just like I did from the History and Habits wizard. If you entered a problem by mistake, you also have the ability to remove it from the patient. Problems that have been resolved should be handled from the problems list and not deleted. When I select Create Note, it opens up an option of different types of notes that I can create. Today I'm going to use a progress note. This allows me to choose a template for the patient who is returning. Prior to selecting the actual template, I have the ability to import a document. This will be allowing me to include specific sections or the entire note. Within the note, all of the sections that need to be completed are on the dark action panel. Within the chief complaint, you have the ability to check mark, click on the wizard, and manually enter a complaint. The HPI allows you to enter the information in two different methods. One is using a form. This allows you to click on the lines and make your selections. If you choose the paragraph, you'll click on the blue links to select responses. The PFISH, or Past Medical, Family, and Social History, allows you to bring in everything that you completed from the face sheet. By clicking on C for Comprehensive, it will bring in the problem, the date of onset, and the notes. The Review system allows you to enter the admits and denies that the patient has relayed. Vitals can be taken and imported into the note. More than one vital can also be added if needed. The Results section allows you to bring in tests that have been done in the office. At the same time, you have the ability to enter the results. At this point, your MA or nurse would be done with their portion of the note. We would save and hold the charges, and we would close the note. It's a good practice to always also close the chart. Going back to the desktop, this time I'm going to right-click on my patient and change the tracking. Tracking tells the doctor that the patient is in exam room 2 and ready for the doctor to see. The provider will also navigate by left-clicking on the patient. When the provider gets to the face sheet, instead of creating a note, they're going to click on the documents. This will allow them to open up and select the most current document that is already in progress. They have the ability to review or make changes to any of the sections that have previously been completed. The provider will complete the physical examination. You have the ability to click on the appearance and use the terms that are already listed. You also have the ability to click on Constitution and do a text view and be able to type in what your findings might be. Because the physical exam has only the systems that you're normally completing for your specific template, you do have the ability to open up and add any other area that might be needed for this particular exam. Likewise, if you're not going to do a specific exam, you have the ability to quickly remove that section. In the drawing section, you have the ability to bring in specific portions of the anatomy. You also have the ability to import from the image library. In the assessment section, you'll be able to check mark the diagnosis codes that best meet your patient's condition. You have the ability to modify them, as well as choose an ICD-9 or ICD-10 code. If the ICD-10 code isn't a one-to-one match, you have the ability to click on the mapping. Once you select the appropriate code, you'll be able to enter any additional discussion needed. On this side, we have two icons. The first one allows us to go out to the past medical hist and problem list. From here, I also have the ability to add to the problem list and past medical history. I also have the ability to mark it inactive or resolved. In the plan section, there are quite a few areas to be completed. Here's where you will choose your labs or search for an order that's not on your template. You're going to insert active medications, bringing in any medication from the face sheet, and then you'll decide if you're going to order a medication that is common for this particular template, if you're going to refill a medication from their previously prescribed medications, or if you need to prescribe a new medication. Today, I'm going to adjust my glyburide. Up pops my contraindications and precautions, and then I can change my prescription. I have instructions that can be added or checkmarked. I have a disposition that will allow me to choose when I want the patient to return. If I were to use this particular response and save and hold my charges, it will automatically send a reminder to the front desk, who will then be able to use the appointment request to make my appointment. A couple other items that you're able to add from a note would be a task, a correspondence letter, such as a referring doctor letter or a return to work or school, and an outbound referral. Note that once I've saved my plan section, I can now go to print or send a prescription. Sending a prescription that already has the pharmacy attached is as easy as OK and prescribe. My final section that needs to be completed is the evaluation and management section. I will determine if this is a new patient and whether the visit focus primarily was counseling or coordination of care. I also will indicate the complexity of the medical making decision. In the complexity override for each diagnosis code, I will enter the most appropriate response. Additional information will be checkmarked. My next step will be to calculate the E&M code. If you don't agree with this code, you do have the ability to override it in the white encounter box. My diagnosis mapping is listed below, and I'm now ready to save and sign my note. Prior to signing, you should preview the note to make sure that everything is the way you would want it. Once a note has been signed, a print fax document option is available. I'm now ready to return to the desktop, and I'll look to see my next patient. In the meantime, the front desk will check the patient out and or make any appointments needed. Thank you for watching this demonstration. If you would like additional demonstrations regarding your specialty or you have questions regarding billing, please contact us.